thanks all for coming. We've got a wide range of mixture of people here today to learn more about the NHS England pharmacy pilots. I recognise quite a few of you here, but we've got practice pharmacists and community pharmacists and people who want to learn more about being practice pharmacists. We have some practice managers here, people from NHS management, educators, so a good range of people. And the aim today really is to find out more about the pilots and to really learn a bit from each other as well about what would be a good application and to learn more about the process for the applications. We have some excellent speakers to help us out this morning. That font size is tiny, isn't it? Funny, but don't worry about reading that. What we're going to be doing is having a presentation from Rachel Snow-Miller, who's the Senior Programme Lead on the Clinical Pharmacy Programme. And she's going to present the latest thoughts about pilots. But also I think she's probably looking for a few answers about some things as well, aren't you, about some of the applications. And then we've got Chris Cutts from the CPPA, who's going to tell us more about the educational component. And then what I want to do then is take questions once we've had both presentations. And we want lots of questions, please, so start thinking about what's going along. Following that, we'll be running some workshop sessions. There'll be a session in here, one at the back of the room, and one in a room downstairs somewhere, but we'll be guided to the correct room. And the whole idea of those sessions is to try to illustrate some of the ideas and some of the things people are actually doing currently, to give you some feeling for what is possible for practice pharmacists to do in general practice. I've been trying to develop practice pharmacy for about 20 odd years now. I took the risk personally about 20 years ago to sort of move to be a practice pharmacist. I had hair then, now I haven't, but it's taken a long time for this to develop, and it really has taken off in a dramatic fashion now, so I'm really excited. I always had the vision that we would have a pharmacist in every surgery in the country, and that does seem like it could be a strong possibility now, which is great news. So, just a couple of other things. They're workshops that we're going to be allocated to later on. I think, is Michelle in here? I think Michelle's actually allocated to people to particular workshops. If you have a particular preference for a particular workshop, then I'm sure we can accommodate you for that. And the other little thing I'd just like to mention is part of the PCPA, Primary Care Pharmacists Association. And there's our friend Ravi on BBC News, I think there. Ravi's formed a practice pharmacist interest group within PCPA now, so we're trying to encourage all the practice pharmacists to join that as a support group. And later on today we'll be launching a guide for GPs considering employing practice pharmacists through the PCPA, and it's also been endorsed by the Royal College of GPs and the Pharmaceutical Society. And I think this should be a very helpful guide, so even if you don't do an employment of a pharmacist through pilots, it's a guide on how you might employ a pharmacist, and it has things like job descriptions in here, and it has basically a guide for what an entry-level type pharmacist might do and what a more advanced level practitioner might do. So hopefully that will be a useful resource for you. It's the sort of thing that we'll have to adapt quite regularly because things are changing very rapidly, but I think it's a good start. Okay, so I think without further ado, we'll crack on. I'd like to invite Rachel up to do her presentation, and Sue, can you help me with